Lifestyle. Among the other modifiable risk factors for cardiovascular diseases, not only does it have a very significant contribution, but also this is something that is decided by a number of social and cultural traditions that people have been following for ages, thinking that they are time-tested. They don't realize how a very small lifestyle derangement can greatly impact their cardiovascular health. This is an area that we can target at an individual level and change the future of cardiovascular diseases. This age group, having the maximum prevalence of cardiovascular diseases, might actually be the most receptive to our awareness campaign and should be targeted to begin with. The very reason that we need to come up with a campaign like this to make people aware of the health of their own heart is not just because people are ignorant of their health. It is more so because people actually don't know the right and the wrong. They don't know the healthy and the unhealthy practices that affect the cardiovascular health. And so, in this How Well Do You Know Your Heart campaign, which is basically a myth-buster program in which, instead of handing them out the myths and the facts directly, we get them to enter into a video-based question series of about 10 to 15 questions, displayed one after the other, each of which would have exactly two options, a myth and a fact, and they'd be asked to choose the correct one according to them. At the end of the series, they'd be prompted to find out how well do they actually know their heart by continuing the video further, which would have a pre-recorded clip of the correct answers to all of those questions with a valid and evidence-based explanation of the facts that we asserted. This way, instead of getting them to just casually read or hear some facts that we want them to know, we actually get them to reflect, even for the minutest of the second, on each of those questions and thus have a deeper impact of all of those facts in their brain. For the implementation of this campaign, hospital waiting rooms and nursing areas might be a really good place because not only do people have a lot of time to patiently answer all of those questions, but also the hospital environment itself makes them really receptive to health-related information than they would be otherwise. For this, we need to contact hospitals and local nursing homes to have a QR code placed at the reception, which would have the link to our video questionnaire, and also convince patients to take up the questionnaire. At the end of the campaign, if people still have doubts about the facts that we stated, they can always confirm it with the physician they're about to visit.